João is currently, among his many other activities, working with the donkey sanctuary full-time. He is a veterinarian from Portugal who also has a PhD in donkey dentistry and has done some groundbreaking research in the area of dentistry in donkeys. He's held academic positions in both Portugal and Spain, and been in private practice, and he's got his own donkeys and draft animals which he drives, including both farming and logging too. Right? So, and you probably noticed he can trim a horse's or a donkey's hooves because he did that yesterday.
Good morning, can you hear me? Is it working? Hello, good morning. Thank you so much for the invitation once again. I was only supposed to approach dental problems in donkeys, something I'll do later. As Eric said, Karen unfortunately couldn't make it, so I'll try to approach pathological conditions of donkey foot. For obvious reasons, I will jump the laminitis part because it's more than covered in the previous talk. Of course, I will address some aspects. It is a very important problem in donkeys. My main goal here is, of course, go through those most common disorders. I will say. When compare, and of course the comparison is inevitable between donkeys and horses, but I would like to focus my presentation on those anatomical differences that can make all the difference when it's time to look for disorders, okay? So, first of all, I would like to say that donkeys do suffer from the hoofs, of course. We can have many different causes affecting the hoofs. Of course, this animal was neglected, you can see. Although it's important to say that in many of these cases, these conditions happen due to sometimes lack of education of the owners, but in many cases, lack of service providers. If you pay attention to this picture, the hoofs were somehow trimmed. The owner tried to trim the possible way he could by cutting the front of the hoof. So there was a genuine concern of this owner to try to solve the problem. Of course, he hasn't the skills to solve it, but the truth is, this is something, it happens. These pictures are from the area where I started working when I finished the vet school. There was a lack of time between the last traditional farrier disappeared from that region and someone new started trimming there. So some of the cases were pretty difficult to solve. So yes, indeed, this can affect the health and the welfare of the animals, of course. Some of these situations are life-threatening. Laminitis is a good example. Something we've been discussing a lot at the Donkey Sanctuary is quality of life. As you may know, we are responsible for more than almost 3,000 animals in our farms. Due to the life care we give to these animals, they live many, many years, and something that is, of course, concerning us is quality of life. And this is my personal opinion, one of the best tools we have in the veterinary world is the fact that we can use euthanasia in a proper way, something that I think is going to be the big evolutionary jump in human medicine when we'll start seeing that as a working tool. That's of course my personal opinion. That's something in the vet world we can use, and when it's time to talk about quality of life, I think it's something we should of course think. Most of these questions affecting hoofs, they need treatment. I will tell you in a second, I will say the main factors that may affect and lead to situations like this. These kind of situations, of course, they are not nice, but with proper trimming, these are some pictures of before and after, and all these cases, they were trimmed at once. When working in, of course, the ideal world, we say we need to trim it in phases, letting the joints, letting the tendons, letting the ligaments to get adapted to the new situation. In the real world, the vast majority of the owners, especially because they are going to pay for a service, especially in the rural world, they don't understand that concept of do it in phases. So basically, we need to be proactive, and you need to find a good equilibrium between before and after. This is another case. This is before, and this is the same animal 10 or 20 minutes later. So my personal opinion is I think we were able to solve this problem quite well, trying to understand the imbalance, trying to understand the problem conformation in these animals, and then trim the hoofs. As you can see, the lateral aspect of the wall was almost removed. It was part of the treatment. These animals are not going to use shoes, so it was basically by balancing we were able to correct this animal. So one of the main aspects affecting the hoofs, it's basically the lack of treatment, the lack of continuous trimming, and that's something that is affecting most of the animals, especially the non-working animals, or like these animals that are working animals but they don't work on a regular basis. They use those animals for seasonal work, heavy work in a specific time of the year. That is actually one of the causes of main problems, because spend 6 months not working, they still feed the animals like if they were working animals, and then suddenly they ask and they demand a lot of effort, and that is causing problems. Another problem affecting hoofs can be, again, I would say lack of knowledge, but incorrect techniques. This is a mule in Morocco, and these are the horseshoe mules in Morocco. That's a piece of tire, and those are normal nails going on a diagonal way from, as you can see, I don't know if you can understand the picture, but basically that is the head of the nails pointing down, and then they bend the nails. Of course, it is, and you can see that they don't trim properly, they just cut the front part of the wall. It is causing a lot of problems. Actually, it was the best way to differentiate from a working animal from a non-working animal, because the owners will not, that they are not from sport horses, they will never use this kind of shoes. So in the hospital, it was at the American Fonduc in Fez, in Morocco. It was our way. Sometimes they try to bring animals in that they are not working animals to receive free treatment, and by the way they were using these shoes was one of the ways to differentiate these animals. Another thing that can cause a lot of hoof problems, as well as other back and neck problems, is work. In this specific case, this is a picture in Mexico, is not the fact, we saw yesterday that animals, and donkeys specifically, are very good as pack animals. Here, for example, is a question of a load that is not balanced. As you can see, is not the fact, probably there's a question of overweight, maybe, it's true. First of all, they also have a frog, they also have the sole, they also have the wall. But when we look at the shape of the animal, for example, and this is a donkey, you can see that this is a front hoof of a donkey that is more narrow than a hind foot of a horse. So they are completely different, and this is very important. Like here, for example, you can compare different perspectives of horse. The big one is a horse, the small one is a donkey, and you can clearly see that they are completely different. And one of the main differences is the hoof pastern axis, as well as the angle that will change, of course, the angle. So first important thing is that donkeys, they do have more vertical, this axis is more vertical than in horses. A normal angle, let's say this red line with the ground in horses is around 55 degrees. So this angle here is around 55 degrees, and in donkeys goes up to 65. The angle, it must be 180 degrees the same way, so it's a straight line. Every variation from this straight line, this hoof pastern axis, it is pathological, or is at least a conformational problem. But the angle is different, and that makes a huge difference when it's time to trim. When we trim a horse, normally we just leave the wall in contact with the ground. We leave the concave sole, and we leave the wall in contact with the ground. If we do that in a donkey, because it's more vertical and more close, what is going to happen is we increase the chance of having vertical fractures on the wall. And that's very important. So when trimming a donkey hoof, we usually leave the external 1/3 of the sole at the same level as the wall. So it helps us to give support. And when, for example, we have seedy toe and we need to remove and eliminate all the wall, it's still very comfortable for the animal, because that 1/3, the external 1/3 of the sole, is at the same level of the wall, so it's compensating somehow. Okay? That's the bigger size of the previous picture. It is very important, especially when you work with hairy donkeys, as I do, it's very important that you really palpate. And I'm going to highlight that again when we're talking about the teeth. But it's very important that you palpate, because if those donkeys are very hairy in the front part of the hoof, probably that angle, it may seem abnormal, but it's not. We just need to use our hands and palpate to check. As I told you, any variation of these angles in this axis are pathological. And we need to address this when it's time to trim, because of course on the left side we need to remove more from the front part of the hoof than from the heels, and in this case is exactly the opposite. In this case, if I want to give back again a straight line, I have to cut here, so the hoof will come down, we reduce the heels, we then touch here, and we correct the angle. Of course, all these variations can also be not only in this vertical, but they also can be horizontal, and of course, this is the previous case, it will interfere with the way we need to trim. But these are the typical cases that only by understanding angles, axis, and how it's supposed to be the normal anatomy and the normal hoof of a donkey, it will allow us to correct, or the farrier to correct. Okay? These small differences are very important, especially the angle and the way we trim, but apart from that, this is basically mechanical work to correct. Of course, it's very important that this time we're able to check joint integrity, if there is pain, if there is not pain. Some animals will react pretty well just by changing all the angles and start walking again. Some others will be very painful, and we need to do a lot of extra care. That can be changing the bed, restraining the movement, or use some kinds of painkillers to help the animal. Another important difference is, and when we check and when someone tells us in the vet school how to diagnose, for example, a chronic laminitis with rotation, one of the things we do, we palpate the coronary band, looking for P2, P3, and looking for a gag. In normal condition is like this. If there is a rotation, there is a hole. Actually, that's quite accurate for horses, because P2, P3 are exactly at the level of the coronary band in horses, but in donkeys, P2, P3 is a little bit deeper, as you can see in that picture. So if we can still palpate, but you don't palpate like this. You go deeper, you change the angle to look for that. Of course, there are other clinical signs. We will see that the sole is not concave, it's flat or convex. We will see that the white line is not a white line, and it's more like a kind of a white groove. So, but these differences are important, because if you are only used to palpate horses, of course, in many cases, if you don't change the angle, what you will be palpating is directly P2. So you say, no, there's no gap here, there's no rotation, because I don't feel anything. Of course not, because you need to change the angle. And this is something that is important. That's an X-ray with all the angles. For those who are not vets, this is the typical relations we need to have both in donkeys and horses. So in theory, the third phalanx, the bone, should be parallel with the hoof wall. That's something we measure in the cases of chronic laminitis, the rotation and the degree of rotation. But also for you, as you can see there, what says the P3 descent, 0.91 centimeters. If we are used to only horses, and you take the X-rays and you compare, what is going to happen is you will say that, okay, there was no rotation, but there was a movement, a vertical movement of the phalanx. And actually, it may happen. It's something that happens in the laminitis, but please be aware that in donkeys, that relation is a little bit different from horses, okay? So, taking some aspects about the laminitis, we already saw some of the images. This is a schematic representation of the image it was presented before. Some of those images, for those who never saw the laminar tissue, there are some variations, like the papillas or the lamina itself. They regulate, but basically these structures, they keep an equilibrium between the wall and the bone, and somehow there's an equilibrium between the flexor tension that the flexor tendons give and this lamina, and that's the equilibrium. That's a shock absorber. It works in many different ways. So when this equilibrium is lost is when we have the rotation. As mentioned before, there is a lot of predisposing factors that may cause laminitis. We already saw many of the nutritional aspects. We also saw the metabolic conditions. Other hoof disorders can lead to laminitis. The working conditions, the working efforts, as I told you, the retention of the placenta, inflammatory conditions of the gastrointestinal tract. So please be aware that something that is affecting the animal now can lead to other problems later, and this is very important. When talking about clinical signs of laminitis, it's true that donkeys are very stoic and they are experts in not showing the clinical signs. It's my personal theory, but I have a theory, the donkeys are great hiding mainly chronic pain. When it's time to talk about acute pain, they do show pain. When something is really acute, they react. Of course, they don't overreact like horses, running or jumping, but they do react. What we need to learn is how to read donkey language. They can be very expressive inside his subtle way to show. They can be very expressive, and once we learn that, we will see when the pain is acute, we will see those reactions. In the specific case of laminitis, because the pain is in the front area, they change. Why animals keep like this? Basically, they are trying to avoid the weight on the front part, so they try to put the heels. That's why there is this kind of difference between the weight bearing in the hind limbs and the front limbs. And this is telling me that this animal is suffering from pain and he's looking for comfortable position. Okay? Is one of the most, and I put this picture here because I really like this because it clearly shows what can be the disruption of the blood supply in a case like this. Other clinical aspects, and in many animals we see these rings in the hoof. They tell us that these cases are chronic. Basically, the hoof grows continuously from the coronary band until the end of the hoof, continuous ring, so we see it as a continuous surface. If something affects the growing of the hoof, we will see it like this. And of course, we saw some of the pictures, but this is a normal donkey hoof. You can see these lines are completely parallel, and that's a normal case of rotation of the third phalanx. And if you compare that metal line, the white line is a metal piece of it's a piece of metal in the hoof wall, and you can see here in normal conditions the different angle, but we still have P2, P3 at this level, and if you check there, it's much deeper. So there was a rotation there, but also change. There is a vertical movement of the hoofs, and you can see there. You can see the differences. And here is a schematic scheme. But for me, the most important thing is not only the rotation of the P3, the alteration on the hoof wall, and here that was the union line. This white line now is not a line anymore, and it's a bigger space. So this is a promotion. This is an entrance for bacteria, for foreign bodies that may affect, and it can cause CD toe. So animals with chronic laminitis are more prone to develop these kinds of clinical situations. And once again, the importance of the relation between one and another. A post-mortem image again with the rotation. When talking about treatment, of course, we have the medical treatment, and then we have all the support treatment. This is basically the protocol in a very generic way. The protocol we use at the Donkey Sanctuary with vasomodulation, using a sapromazine, trying to reduce the inflammation, the mechanical support, and this is something really, really, really important. Animals may be really painful, so they need to feel comfortable. And we cannot only rely on drugs to keep this animal comfortable. There is a lot of things we can do as owners, as vets, to improve the comfort of these animals, the analgesia, and for example, especially in cases we have the rotation of the P3 and the sole is changed. Of course, we are going to need to trim those hoofs in a different way, not touching the sole, only cutting on the heels and on the front of the hoof. But while the process is happening, is not a good moment to trim those hoofs. When the animals have this crisis, of course, we try to protect bilaterally, once and another. Sometimes it's very difficult because the animals are so painful, they will not allow us to put the bandages. And this is an image of an extension. So we increase the size of the hoof, and we avoid the contact with the convex sole with the ground. This is a kind of hard silicone, and then there's one moment that when the animal is more comfortable and we can trim, we just remove this. We can cut it exactly the same way, and step by step you introduce all kind of treatments. Of course, dietary modification. Many of these animals may have overweight, so it's important, as we saw before, to think about dietary modifications. It's very easy to say box rest. Please be aware of the material you use in pets. Donkeys